Welcome to our Resource Rundown on-demand webinar from the Office of the Cabinet Secretary with the Department of Human Services. My name is Cassandra Tolliver, and I will be presenting your guide to assessing services for your child. I'm so excited to share this information with you. When we're going over this, please keep in mind that this is a broad overview and not child or family specific. If after this session you have a question that is specific to your family or situation, I encourage you to use or to reach out to us, the Kids Thrive at wv.gov. So Kids Thrive at wv.gov. Okay, we will go ahead and get started. Being a teenager isn't easy. Being an adolescent isn't easy. Parenting isn't easy. And I'm talking about all parents. It's just not easy. Birth parents, adoptive parents, kinship parents, foster parents, grandparents, all parents. If you are a resident of West Virginia and have a youth in your care who is between the ages of 3 to 21 years old, then this is for you. Does your child have a mental health diagnosis? Are they having behaviors or emotions that interfere with their home life, with school, or with community activities? Are you worried about your child and just not quite sure where to go or what to do? Are you feeling overwhelmed by your child's behaviors and seeking support or guidance? Are you really just not sure, but you want more information? If any of that sounds familiar, then the information that we're going to present is for you. During this resource rundown, we'll talk to you about ways to access help for your child. We're going to keep things as simple and straightforward as possible. The services that I'm going to talk about will cost you nothing. Just keep in mind that as we continue, just keep that in mind as we continue. So where do you start? If you want to get help for your child, or you just want to find out about available resources in your area, then I encourage you to call or text 844 HELP for West Virginia. That is 844 435 7498, or Help for West Virginia, 844 HELP for West Virginia. You can even scan this QR code from your smartphone. That will take you to the Children's Crisis and Referral line. And honestly, you're step one. Who can call? Anyone. Does that mean you're now involved with CPS or the police? No, this is neither. You just need to think of this as your front door to resources. If you're hesitant to call Help for West Virginia, then don't worry. You can also chat anonymously with Help for West Virginia, or if you want other options, you can reach out to your primary care provider, your school personnel, your local Department of Human Services office, or you can submit an application yourself at any time. After you contact Help for West Virginia, here is step 2. As you're speaking or texting with Help for West Virginia, they may mention things like CSAID or wraparound or crisis. What does that mean? They're just gathering information to determine what your need is and identifying if you need assistance right now. If you're in need of immediate assistance, they will offer you Children's Mobile Crisis, which is for that immediate, as soon as possible, someone help my child right now situation. And you can talk on the phone or meet in person and meet anywhere that is helpful for you, even in a Walmart parking lot at 10 o'clock if you need it. Does asking for help or asking them to meet you mean that you are interacting with CPS or that anyone will take your child? No. Remember, Help for West Virginia is not CPS or the police. You're simply continue with your conversation with Help for West Virginia to determine what other services will meet your needs. When speaking to Help for West Virginia, they can mention wraparound. What does wraparound mean? Wraparound is a way of working with youth and families by offering community-based services that are intended to wrap around the family, putting and keeping the family and youth at the center. It is designed for you. Help for West Virginia may ask if you would like to apply for CSAID waiver. And CSAID stands for Children with Serious Emotional Disorder. Don't be alarmed by that title. That's just the name of the services so that your child can receive support in your home or community for their mental, behavioral, or emotional needs. So, in other words, CSAID is simply part of wraparound, and they might ask about your interest in other available services. So, let's say you want to start the application process. I know that this may sound like a lot, but stay with me for just a minute. I will summarize in a few slides. Let's continue to your coordinator column. You'll receive a call from a coordinator. We'll call her Sarah. Sarah, the coordinator, who will be your contact person through the application process. Coordinator Sarah will ask you about what you are experiencing with your child, how your child does in various settings such as home, school, and social settings. And from this point, you're having a conversation with all questions that are tailored to your specific situation and build on each other. The purpose of these questions is to verify the information in your application and to gather additional information that is needed. Prior to your call ending, you'll be informed of the next steps, when you can expect another call. Coordinator Sarah will tell you what resources are available to you in the meantime and provide you with contact information specific to your county. Don't forget, you'll have Coordinator Sarah's contact information for any questions during this process. So you've spoken with your coordinator, Sarah. Now what? Within 4 business days, you'll receive a call from someone with CSAID program. We'll call her Ashley. And they may say Essentra, but that's just their agency. Ashley with CSAID will explain who they are and request a time to complete a CAFAS, the first evaluation to determine eligibility. That's what a CAFAS is. This call will last approximately 40 minutes and assess your child's level of functioning in various settings. Have I mentioned that it's not CPS? None. None of this is CPS. Once you're done, Ashley will give you a list of independent evaluators. That's a fancy term for someone to complete a psychological exam that you get to choose from. A psychological evaluation gathers information about how your child feels, thinks, and behaves, and helps identify the best way to address presenting concerns. Don't want to? Need a few days? No worries. You don't have to. This process could be put on hold for you to consider other service options. For example, for the sake of the resource rundown, we're going to say you're ready to schedule. Well, then Ashley will set that up for you. Ashley with CED will request a time to complete a CAFAS. Again, that is the first evaluation to determine your eligibility. This call will help access your child's level of functioning in various settings. Have I mentioned that it's not CPS? None. None of this is CPS. Once you're done, Ashley will give you a list of independent evaluators. That is a fancy term for someone to complete a psychological exam that you get to choose from. I know you've heard a lot so far, so we want to summarize to this point. By now you have called Help for West Virginia seeking services for a child in your care. Linked and referred to appropriate services such as Children's Mobile Crisis Response for immediate assistance as needed, referred to a Centra for CSID eligibility determination if it is wraparound, scheduled a CAFAS or PECFAS, and evaluation. We call her Ashley, and you've been notified by mail. During all of this, you still have the same coordinator. We called her Sarah that you can talk to. During this entire time, you still have Sarah to contact with questions, and you can still use Children's Mobile Crisis Response for immediate assistance. An example might be if you feel your child is out of control and you need help, the Children's Mobile Crisis Response can help stabilize the situation while longer-term services such as wraparound are put into place. This might look different for every family, and that's okay. Keep in mind, this is still not CPS. So what do you do while you are waiting for CSID eligibility determination? Coordinator Sarah is going to provide you with a list of agencies that you get to choose from to start providing wraparound services. Think of this list much like a shoe shopping. There are multiple shoe stores, and they all sell shoes, but you must have a preference on where you prefer to buy your shoes for whatever reason. You pick the store that is best for you. Same thing applies when choosing an agency. They offer the same services, but choose whichever one you prefer. What services are offered through wraparound by these agencies? Conflict-free case management, which includes one agency providing the facilitator, and services go through a different agency for your other services. Your first agency will provide your wraparound facilitation. You'll have a wrap facilitator that coordinates the services that are tailored to your family. Your family and your child are the focus. You make the decisions on what services you want provided, who will provide them, and where they're provided. Which brings us to our second agency for services. Your wraparound facilitator will work with your family to identify your team and coordinate which services you need. So don't stress about which services to pick. When you choose your wraparound service provider, these services include in-home and out-of-home therapy, in-home family support, respite, in-home and out-of-home, specialized therapy, community transition, peer parent support, independent living skills building, individual supported employment, assistive equipment, job development, and non-medical transportation. Next, you will get linked to the agency of your choosing, where you will work together to develop a plan that is specific to your child and family. Again, you are not locked into services. At any point in time, if you are the legal guardian, you have the right to decline or discontinue services whenever you want. If you choose to continue, then services typically last 6 months to 1 year, depending on your child's needs. After 1 year, your child will be re-evaluated. You have the right to refuse services, but we hope if your child is eligible, you will stick with us. Research shows that these services are effective at improving children's lives and helping them thrive in their communities. We want the best for your family. You might not know what all of this means and may never have heard of these terms mentioned. That's okay. Contact us and we'll gladly point you in the right direction. We would love to hear from you. So email us at westvirginiawraparound@wv.gov anytime.